Hello friends. Welcome to Homeopathy Medicines. Today in this homeopathic Materia Medica, I will discuss about homeopathic medicine Spongia tosta. Before starting this video, please subscribe to this channel. We need support from you to make this channel more beautiful and more informative. Now going to discuss about Spongia tosta, its uses and symptoms. A remedy especially marked in the symptoms of the respiratory organs, cough, croup, etc. heart affections and often indicated for the tubercular diathesis. Children with fair complexion, lax fiber, swollen glands. Exhaustion and heaviness of the body after slight exertion, with orgasm of blood to chest, face. Anxiety and difficult breathing. Mind, anxiety and fear. Every excitement increases the cough. Head, rush of blood, bursting headache, worse, forehead. Eyes, watering, gummy or mucus discharge. Nose, fluent coryza, alternating with stoppage. Dryness, chronic, dry, nasal catarrh. Mouth, tongue dry and brown, full of vesicles. Throat, thyroid gland swollen. Stitches and dryness. Burning and stinging. Sore throat, worse after eating sweet things. Tickling causes cough. Clears throat constantly. Stomach, excessive thirst, great hunger. Cannot bear tight clothing around drunk. Hiccup. Male, swelling of spermatic cord and testicles, with pain and tenderness. Orchitis. Epididymitis. Heat in parts. Female, before menses, pain in sacrum, hunger, palpitation. During menses, wakes with suffocative spells, cupor, ide, latch. Amenorrhea, with asthma, pulse. Respiratory, great dryness of all air passages. Hoarseness, larynx dry, burns, constricted. Cough, dry, barking, croupy, larynx sensitive to touch. Croup, worse, during inspiration and before midnight. Respiration short, panting, difficult, feeling of a plug in larynx. Cough abates after eating or drinking, especially warm drinks. The dry, chronic sympathetic cough or organic heart disease is relieved by Spongia, nausea. Irrepressible cough from a spot deep in chest, as if raw and sore. Chest weak, can scarcely talk. Laryngeal-thysis. Goiter, with suffocative spells. Bronchial catarrh, with wheezing, asthmatic cough. Worse cold air, with profuse expectoration and suffocation, worse, lying with head low and in hot room. Oppression and heat of chest, with sudden weakness. Heart, rapid and violent palpitation, with dyspnea, cannot lie down, also feels best resting in horizontal position. Awaken suddenly after midnight with pain and suffocation, is flushed, hot, and frightened to death, acne. Valvular insufficiency. Angina pectoris, faintness, an anxious sweat. Ebullition of blood, veins distended. Surging of heart into chest, as if it would force out upward. Hypertrophy of heart, especially right, with asthmatic symptoms. Skin, swelling and induration of glands, also exophthalmic, cervical glands swollen with tensive pain on turning head, painful on pressure, goiter. Itching, measles, sleep, awakes in a fright, and feels as if suffocating. Generally worse after sleep, or sleeps into an aggravation, latch. Fever, attacks of heat with anxiety, heat and redness of face and perspiration. Modalities, worse, ascending, wind, before midnight. Better, descending, lying with head low. The mental symptoms of Spongia show that it is a heart remedy. When a remedy produces the anxiety, fear, and dyspnea found in Spongia, it will most likely turn out to be a cardiac remedy, unless these conditions are connected with irritation and inflammatory diseases of the brain. In this drug we find without any cerebral symptoms, marked anxiety, fear of death, and suffocation, associated with palpitation and uneasiness in the region of the heart. It is especially related to cases where there is pain and a sense of stuffiness and fullness in the cardiac region, in the chest, with dyspnea, anxiety, fear of death, fear of the future, fear that something dreadful is going to happen. Wakens at night in great fear, and it is some time before he can rationalize his surroundings, like Sam, Latch, Phos, and Carbo-Veg. Spongia is closely related to aconite, which also excites the heart, brings on anxiety, fear, and restlessness. Fear of death, predicts the hour of death, but this is associated with a marked febrile excitement. Spongia has febrile excitement in a minimum degree. It is much deeper in its action than aconite. Its cardiac diseases tend to develop slowly, with actual tissue changes, enlargement of the heart. It takes on a steady growth and the valves become changed, do not fit, hence, there are blowing and whizzing sounds, regurgitation with the mental symptoms. The two are similar in croup, but Spongia is deeper, slower in onset, taking several days for its development. Aconite from exposure to a dry cold wind takes a cold today and, of course, comes down with croup tonight in the first sleep. Before midnight has a dry spasmodic cough, hoarse cough. Spongia has taken a cold yesterday or the day before. First there is roughness and dryness of the mucous membranes, sneezing. Both remedies have croup before midnight with dry, hoarse, barking cough, sawing respiration and dry air passages. They are so similar that when aconite only partially controls the condition and it returns the next night, or lasts on beyond midnight, Spongia becomes its natural follower. Spongia comes in because it was probably the remedy in the beginning. Cases that grow worse each succeeding night, hoarse barking and crowing before midnight, though it also has a croup after midnight. It is a deep-acting remedy, though its complaints sometimes come on suddenly. Heiper is worse at night and in the morning. And when aconite has apparently controlled, but the croup returns the next morning, heiper comes in. Or if it comes on again the next evening with rattling, heiper will also be suitable. Dry, with no rattling, is Spongia. If the child wants to be covered or says that it is chilly, heiper. If it says the room is too warm and kicks the covers off, it needs Sal. The Spongio patient is worse from a warm room, from heat. Wants to be cool like iodine, but is better from warm drinks, like ARS, Nux, like. The tendency to affect the glands is striking. As a matter of fact, all the glands are affected, they gradually enlarge and become increasingly hard. Glands that have undergone inflammation and are increased in size become hard, or they take on hypertrophy. Hypertrophy of the heart, Comia, sepia, nausea. Spongia has cured endocarditis, cardiac croup and many other inflammatory diseases of the heart resulting from rheumatism. Hypertrophy of the thyroid, goiter, when the heart is affected and the eyes protruding. Cervical glands enlarged, inveterate cases of enlarged testes, orchitis from a suppressed gonorrhea, a cold or other causes, gradually increasing hardness. The whole respiratory apparatus is acted upon, cardiac dyspnea and the most severe forms of asthma. Dryness of the air passages with whistling and wheezing, seldom rattling, must sit up and bend forward, at times after great dyspnea, white, tough mucus forms in the air passages, difficult to expectorate, it comes up and often has to be swallowed, ARN, Quast, Latch, Kali C, Kali S, Nux MOS, September, Staph. Dyspnea worse lying down. The modality is common to its other complaints. Violent, basilar headache forces him to sit up in bed and keep still. Holding the head in the upright position relieves the dull pressure in the occiput. There are many headaches. In the occiput, in the forehead, congestive headaches, but most of them are associated with goiter, cardiac affections and asthma. They are due, probably, to sluggish circulation in the brain. Face distressed in croup, anxious, livid, pale and bloated, blue, pale with sunken eyes, red with anxious expression, alternating red and pale, cold sweat. These symptoms are the natural effects of difficult breathing and are, therefore, not essential in the selection of a remedy. As primary symptoms, they would probably indicate ARS, but when due to cardiac difficulties, they are unimportant. Sore throat worse after eating sweet things. thyroid gland swollen even with a chin, at night, suffocating spells, barking cough, with stinging in the throat and soreness in the abdomen. Enlargement of the tonsils. Difficult swallowing. Spongia is the remedy when dyspnea and cough are relieved by warm food, may be better from warm drinks. Laryngeal troubles with great hoarseness, in individuals tending towards phthisis, with tubercular heredity, cachectic aspect, weak lungs, but no deposit of tubercle. But all at once hoarseness sets in. There is a tendency for the larynx to become involved in phthisical patients that need spongia. This patient takes an acute cold and it settles in the larynx with hoarseness. Look out for that patient, for there is a tendency for tubercles to deposit where there is inflammation, and the infiltration instead of being fibrinous may become tubercular. Tendency for the larynx to be first involved in phthisical patients. In spongia do not look for the exudative, but the infiltrative form of croup. Hoarseness with loss of voice, great dryness of the larynx from a cold, coryza, sneezing, the whole chest rings, is as dry as a horn, voice hissing, croupy, nose dry. There is very little accumulation of mucus, but at a late date ulceration begins and then there may be a copious expectoration of mucus. In proportion to the extent of rattling, this remedy is decreasingly indicated. Heparin has the coarse rattling with much mucus. At times an adult takes cold and rawness of the larynx and trachea is the result. On going to bed she is taken with a spasmodic constriction of the larynx. Laryngismus stridulus is commonly found in women. IgN, gels, Boericke, and Spongia, IgN, and gels, will curate out of 10 cases. The larynx is sensitive to touch and croup, etc., like foes. Dry, spasmodic cough, troublesome cough, cold things taken into the stomach aggravate. Verator is better from cold water, but the cough is worse if the room becomes too warm. There is a dry, tickling, teasing, croupy spasmodic cough. In cardiac and asthmatic troubles it resembles latch. In the rousing up from sleep in suffocation, after the sleep the dyspnea is worse. The foes. Dyspnea is often increased after sleeping, with suffocation. Latch has it in a marked degree. In phthisis when the patient is about to die, there is sweat on going to sleep, dyspnea on going to sleep and on waking. Latch palliates and must be repeated. Cardiac affections accompanied with thick, green or yellow expectoration like pus and dyspnea on falling to sleep so that he must keep awake as long as he can, fear of sleep in advanced chest troubles. Grindelia robusta will palliate such a case and if the condition is only catarrh and not tuberculous, it will cure. Study especially the cardiac symptoms. The symptoms of circulation are worse, from mental lassitude, from coughing, from lying on the right side, before menses, after lying down, sitting bent forward, from smoking, from going upstairs. Awakens in fright and feels as if suffocating. Falling asleep early at night, suffocation awakens. I have mentioned these symptoms, but read them for emphasis. Ebullitions, distended veins, dropsy in cavities of the body especially suits young persons of tubercular parents, who remain weak, are pallid and do not thrive. Tubercular diathesis. Itching but no eruption. Seems always ready for an eruption to appear. Has only simplest herpetic eruptions. Itching all over and no visible eruption. In acute endocarditis, the principal remedies are Spongia, Aberrant, Sepia, and Homeo. Nausea in valvular diseases. Thanks for watching this video. If you want more videos like Spongia tosta, please subscribe to this channel and press the bell icon. Comment us your feedback. Like and share this video with your friends and family. For paid and free consultancy online, visit homeopathymedicines.com and mashclinic.com. Thank you. Have a nice day. Stay healthy, stay happy.